Hello, and thank you for watching this video about the impact of the COVID pandemic on NHS staff. This video was put together by staff working for KMPT, the Kent and Medway NHS and Social Care Partnership Trust. At KMPT, we have a Cognitive Analytic Therapy Special Interest Group, or CATSIG for short. At the CATSIG, we share our ideas and our knowledge from a cognitive analytic perspective and generally support each other. It's a great space and everyone is welcome. So what is cognitive analytic therapy, or CAT? In CAT, we try and understand how relationships affect how we think, feel, and behave. In CAT, we draw out our relationships where we think about both ourselves and other people. For example, if you're feeling cared for, the other person is caring. When we draw out relationships in this way, we call it mapping. Over the past year, in the CAT Special Interest Group, we've been using the tool of mapping to help us talk about the way COVID has affected us as NHS staff. We've made this video to share some of the map with you. So when the pandemic hit in 2020, I guess most of us were pretty terrified. The threat to us was literally, I could die, or my family could die. As the pandemic affects us here and our friends and family around the world, this threat is not going away even now. We feel vulnerable, anxious, and uncertain about what is going to happen. As I said earlier, in CAT, we think about relationships. If we consider our relationship with COVID, it is dangerous and harming, and we are harmed and vulnerable in response. So how do we cope with this new and terrifying threat? Certainly at the beginning, there was an admiration for NHS workers. We had the clap for heroes every Thursday night, and a lot of people felt pressure to work hard to stay in that admired place. Working hard, but remotely, we may have started to feel detached, disconnected, drained, overwhelmed, exhausted, and burnt out. When we feel like this, we try and find ways to feel better. Some people eat and drink too much and buy things they don't need. Then we can feel bad for doing this or worry about it. When we feel out of control and powerless, we may start to think differently about others. We may think that the people making decisions are detached, uncaring, and untrustworthy, and so we feel mistrustful and withdrawn. This may leave us feeling angry, and at an extreme level, we start to feel suspicious and not believe what we are told. With each other, we can start judging and criticising other people, for example, for not following COVID rules or for apparently not working hard enough. The term shirkers and workers came around, which wasn't very pleasant. Judging and criticising others can help us feel more in control, but it can also create splits or divides between us. Our sense of what is right and wrong can become very strong. For example, people may have strong views about the vaccine and about people not wearing masks. When we feel afraid and out of control, it can feel much better or safer to be in a judging or criticising place than to feel out of control and powerless. With the sudden changes in how we work, we might feel so de-skilled and confused, we don't know what to do. We might then do nothing, hide away, and feel lost, angry, or overwhelmed. Some people may go off sick or leave their jobs. In CAT, we try to think about how to cope with these feelings and experiences. We call these ways out exits. So what are the exits? I guess the most important one is about spending time and connecting with others again. It's also really important to be honest about how we're feeling and to listen to each other. When we do that, we can feel heard and understood. We need to care for each other and care for ourselves. We need to allow ourselves to stop striving. to stop trying to be perfect and see that at times like this, it's okay to be good enough at our jobs. And our leaders need to show us their vulnerabilities too, and to be present, visible, and to listen to us all. But of course, the best person to care for you is you. No one can read your mind and know how you're feeling. So it's got to be you putting yourself first and caring for you. Perhaps you can think about ways you can get some support at home and at work, and make sure you take time to do things that you enjoy. Things are changing all the time, and every time things change, our stress and anxiety may increase again. It can feel exciting when lockdowns ease, but it can also feel overwhelming and tiring to start meeting up with people again. Some people will feel deeply distressed by what has happened. Many will be grieving the loss of loved ones. Many will have long-term health problems such as long COVID. We need to listen to and support each other, welcome colleagues back to the office, and support those who will continue working from home. Thank you so much for watching this video, and please share it in your team and with your colleagues, and maybe take some time to talk about it together. And a big thank you to everyone who contributed in the CATSIG, some but not all of whom we have listed here. If you'd like to get in touch to talk about this video, give feedback or ask a question, please contact Sarah Casado on the email here. Thanks again for watching and keep safe.